So thanks everyone for joining. My name is Alex Chan. I am the mental health specialist with the University of Maryland Extension, and I'm happy to be hosting the meeting with my colleagues here from the Maryland ROPTA team. I see we have most of us logged in. We have Julie Slivka, Beth Williams. We even have some emeritus members of our team in the audience, so welcome back. Yeah, we're all happy to be sharing some updates with you all today, as well as spotlighting some of our partners in the world of mental health and substance use services. So this is our agenda for our 1-hour meeting today. We're going to share some updates, some very exciting updates, I think, about our project. And just so that everyone is on the same page in terms of what we are offering and what some of our project targets are. So I'm going to jump right into that. And then we will have about 15 minutes each for each of our partner spotlights. Stephanie Hutter-Thomas with Appalachian Recovery Concepts, and then Kate Fahrenholt with NAMI Maryland. All right, so our updates this year. We do hold this meeting twice a year, so there have been changes though since the last time we held this meeting in February. So we're excited to share some of that. Some of our ongoing work is supported by SAMHSA, and our goal through our funding with SAMHSA, we have the Mental Health Awareness Training Grant, which is really funding our mental health first aid training. And one of the aspects of this program is that we're not just training people in mental health first aid. We actually are being asked to track the referrals that people are making, which we think is a really good idea because it shows kind of the impact beyond the class of some of our mental health first aid efforts. You know, it's not just who's being trained and what, you know, did you learn something? It's also how many people are you then connecting to mental health services. So if you are receiving a mental health first aid class from us, especially as an organization, we're going to be following up with you on a regular basis during the grant period about how many people your organization has referred after we trained you all. So that's one kind of newer element to the work that we've been doing. We're also moving ahead with our regional ROTA efforts. So we're actually part of a collaborative with the states that you see pictured there: West Virginia, Pennsylvania, Delaware, Maryland, and Virginia. And this is titled REACH, which, you know, the acronym escapes me right now, but Penn State is the host of our regional ROTA efforts. So I encourage you all to visit this webpage. They have monthly webinars. They have a variety of different topics because each state is sort of in charge of providing their own education on something relevant to the opioid crisis. So we're a part of that. We provide a couple webinars a year. And this also funds our mental health first aid efforts. So under this grant, we are aiming to reach 100 participants per state per year. So hopefully one of the things that you see about our ROPTA programming is that we're really looking for mental health first aid participants. In years past, this has been a popular program, and Julie will be reviewing just how many people we've already reached in a minute, but we definitely have upped our targets. You know, we're you know, it's already just between these two grants 350 people per year that we're looking for, plus a little more actually. So be thinking about mental health first aid as something you might offer to your organization, your staff, even your partners. We love to kind of extend the partnerships out there. So, and if this is your first time hearing about mental health first aid, we will also go over what that is in just a moment. So I think one of our biggest updates here is actually that we've had our funding renewed from another source. USDA NIFA has awarded us a grant from 2023 to 2026 to continue to serve some targeted counties in Maryland that are meeting a certain definition of rural. So depending on the demographer and the list that you look at and whichever federal agency, they define rural differently. But for the purposes of this grant, we'll be particularly targeting the highlighted counties. Now, because of the other funding streams, we continue to serve the whole state. However, through this funding stream, we will be targeting Garrett in Western Maryland, and then Kent, Caroline, Talbot, and Dorchester County on the Eastern Shore. So like I said, these are the targeted counties. However, we can certainly have participants from other counties join in to these workshops, and especially when they're virtual. That's the beauty of being able to offer virtual programming, is that even if a certain area is targeted, we're not going to exclude anybody. But because of our funding, we will be trying to emphasize some of these areas for our activities through this Rural Health and Safety Education Grant. And these are the programs that we're going to be offering targeting these counties. So we do offer statewide, mental health first aid, but that's also part of this program. Regrounding Our Response and Overdose Lifeline are programs that are advocacy and public awareness related, and Julie will be describing these, all of these in a little more detail. But as you can see, we have a wide variety of programs that we're offering. I do want to emphasize that despite the funding being targeted for one of our funding streams on these counties, that really we are here to serve the whole state with these programs. So if you're located in Baltimore City or in St. Mary's County or someplace that isn't highlighted here, please be aware that we will also serve you, and especially if you're interested in mental health first aid, given how high of a target we have for that program. So that's some of our exciting funding and administrative updates. And now Julie's going to share some of our accomplishments and a little more detail about the programs that we are continuing to offer throughout the state, so that you all can get your gears turning about how you might like to work with us in serving our communities. So, and I think Julie will also have some updates about some resources that we'll be sharing at the end of today, since we've got such a nice group of people together.
Awesome. Yes. Thank you, Alex. Hello, everybody. My name is Julie Slivka. I'm a community educator with ROPTA, as well as handling a lot of the marketing and the website and the social media. And I get the divine pleasure of sharing with you some of our incredible grant accomplishments that this amazing small but mighty team has been able to accomplish over the past 4 years of the grant. So in the 4 years that we've had, well, we did start at the end of 2019, we've had about 12,000, a little over 12,000 total training and attendees. That actually includes events, in-person events for about 96% of the people who have completed our surveys at the end, our satisfaction surveys, input surveys, have said that they would recommend this training to others. About 96% also agree that it is what they learned and the skills that they developed during these trainings would be beneficial to their professional development and their work and or practice. So during this time, we had a little shy of 700 trainings and events offered, 676. During this time, we've had 1,230 mental health first aiders trained throughout the state. Go us, go you. Thank you to our partners for working with us to develop these training offerings and helping us promote them and get people into the door for these. Really great resource. We also have had the opportunity to train almost 80 mental health first aid instructors. So this is adding to the work, the force of Maryland, ensuring that there are more instructors around the state being able to provide this training. So we are expanding our reach that way. We've had about 1,239 youth participants. These have been through a lot of our partnership with, after school programs, through, the adolescent clubhouse centers. They've been taking on, Generation RX. This is not about drug trainings. We had a really strong partnership out in Western Maryland with Garrett County High School, as well as Braddock Middle School for BOTFIN classes. That was really great. Speaking of BOTFIN, we've been able to certify 18 BOTFIN life skills instructors through our 5-county rural region that we target. We've had about 151 community partners that we've worked with so far. We're always looking to build and expand that list. So if you haven't worked with us before individually, please reach out. We would love to, custom tailor a training series, or just kind of talk about what the needs of your community or organization are, and ROPTA can help support that, enhance what you have going on there. So we've had just online alone, and again, we launched kind of during the COVID whole situation. So we have a very strong webinar, virtual, online, digital presence. About 7,000 participants. Of those 12,000 were strictly online, which is amazing. And our newsletter, which I think is how a lot of you got here today, we have about 4,000 unique people on our newsletter, which is amazing. You guys are actually reading it. I know that you get a lot of information in your email, so we do appreciate you opening those newsletters to stay informed with what we're doing. So what I'm going to do is I'm going to add our hot off the press new program packet into the chat in just a couple minutes, so you can see our infographic here, but as well as kind of get a better understanding and a deeper overview of all of our programs that we also offer. And you guys can read all of those great testimonials that we have. So Alex, if you want to go on, I'll kind of give a little bit of a overview of what we are doing programmatically over here at ROPTA. So we do have 4 main areas. We've got, the regrounding our response training. This was a series developed by the Maryland Department of Health. It works to promote awareness, resources, and evidence-based strategies for reducing overdose rates and substance misuse. And so that series, it can be a whole series of the 5. We can select from each one of these. That encompasses adverse childhood experiences, medication-assisted treatment as overdose and harm reduction, social determinants of health, the drug user health framework, and stages of change. We actually have a stages of change coming up in September for Recovery Month, so stay tuned for that. We also have this really great partnership with the Overdose Lifeline series. They are a nonprofit based out of Indiana, but we are a licensed partner with them. So through that partnership, we are able to offer a series of their evidence-informed trainings that are aimed at raising overdose awareness, teaching about prevention strategies, and educating about local and national resources. And so some of the trainings under that umbrella are the opioid public health crisis, the brain and the disease of addiction, guide to harm reduction, and this is not about drugs, which is the youth-centric based one. And then if you go to the next slide, we've got the BOTFIN life skills training, and this is an evidence-based 5-week training program that is aimed to develop, to help adolescents and teens develop skills in substance use resistance, as well as their social emotional skill development. So we were able to cover the cost for train the trainer opportunities for people in that 5-county area that we are targeting in rural Maryland. So that has been amazing. If you are interested, let us know. We were recently able to partner with Choptank Community Health over here on the Eastern Shore to train some of their individuals in the school system to get that program out there, rolled out into schools. So that's really exciting. Generation RX, That is kind of a standalone program. It's another evidence-based program. It's great because it can be tailored to different audiences. We can tailor it for elementary age to teens to even college age. And then we also have a very strong presence reaching out and partnering with organizations that work with the older and aging adult community, talking about, safety when it comes to taking medications, taking them as prescribed, as well as storing them and disposing them when necessary. And then finally, we've got mental health first aid. And we are still offering youth and adult mental health first aid. So these are all in the program packet that I'll share in just a minute. But something that is very exciting for ROPTA is we are expanding to offer community specific training. So the National Council released a series of supplemental training courses that can really enhance providers' abilities to really target the exact needs of certain audiences, target audiences. So as ROPTA, we have been able to get our staff, get our trainers trained in these supplemental programs for specifically for rural populations, as well as the aging and older adult community. And what those do is it kind of dives a little bit deeper into the risk factors, the protective factors, the very unique needs and things that are going on in those communities to really ensure that we can tailor our program offering that particular training to the needs of the audience that we are going to be working with, whether that be the general public or perhaps a partner or an organization that really works closely with those communities. So those are some very exciting things that ROPTA is going to be offering this year. And again, I'll drop that program packet in the chat, as well as some of our contact information, as well as our social media links. Definitely follow us and all the good stuff, and reach out if you have any questions or if you'd like to connect and get something rolling in your community. Thank you all so much for your time and for being here today.
All right, thanks, Julie. So hopefully I know we blazed through a lot of what we do, but this is a partners meeting. And so we want to highlight our partners in the work that we're doing as well. And so we have, next up, we have Stephanie Hunter-Thomas, who is a collaborator with us on multiple levels. She has been a member of our team. She is also one of our educators, and she also is a entrepreneur. So she's here to
I'm a whole bunch of things.
Yeah, so she's here to share about her company and how it fits into the world of substance use and recovery services.
Thanks, Alex. So I'm so excited to be back here because, I have a longstanding history with the Maryland ROPTA crew. I was actually one of the original full-time educators on the project, from the original grant back when we were called Maryland ROTA. And in fact, Julie and I were just talking about this online that, it's almost humorous now to think about, but we all kind of trauma bonded, right? We were getting this thing off the ground, and 3 weeks later, everything went remote, everything got shut down, and we were kind of back to the drawing board. So we had to take everything remote, and so since then, I've maintained an ongoing relationship with the team, even throughout, the various changes. So it's pretty awesome to be back. So thank you. So yeah, I actually left the Maryland ROTA project as a full-time member of the team right at the end of 2022. And then in January of 2023, I transitioned to the role of director for a new collaborative research project between WVU and Yale Schools of Medicine. And the project is known as the Birch Project, and that stands for Buprenorphine Implementation Research and Community Health. And essentially, the project aims to integrate or scale up screening and treatment services for opioid use disorder, HIV, and hepatitis C throughout primary care settings in the state of West Virginia. So it's been a really interesting sort of shifting gears for me, to be kind of on that more medical and clinical side and really get a deeper understanding of some of the barriers and the struggles that go on in that arena. I formed Appalachian Recovery Concepts in December, right before, like December of 2021, I guess, right before I was kind of, going to be transitioning because I wanted to be able to continue to maintain the relationships with my Maryland programs that I worked with. I wanted to be able to continue to support Maryland ROPTA and do contract work and different things of that nature. I didn't want everybody to think I just put up roots and ran to West Virginia. And so that was kind of the beginning. And now it's sort of taken on a life of its own. And here we are. So as a consultant, I've collaborated then with the University of Maryland Center for Substance Use Addiction and Health Research, known as CSER. And we basically developed a grant proposal surrounding the recovery workforce that I'll talk about here in a moment. And I'm serving as co-investigator for that project. And exciting to mention, because y'all just got done talking about regrounding our response. So I have been a master presenter for the Maryland Regrounding Our Response initiative since its inception in 2019. And then, when Maryland ROTA was forced to, figure out ways to adapt to the pandemic situation, the regrounding our response stuff just kind of made sense. We needed more curricula, we needed material, MDH, needed people that were going to be able to deliver this online, so that it kind of happened, right? And so in the process, we got Dr. Chan trained to be a master presenter in the whole series as well. Well, since then, since leaving the Maryland ROPTA project as a full-timer, I am now a master trainer for the Regrounding Our Response. And so now I'm working with the Maryland Department of Health Center for Harm Reduction Services in training new master presenters on a regular basis. And I'm also a master trainer now for the West Virginia version. And in fact, last week I was in Morgantown and we just wrapped up another cohort. So pretty exciting stuff. I'm currently working on developing the Regrounding Our Response initiative for the state of North Carolina as we speak. So Appalachian Recovery Concepts kind of, does a whole bunch of different stuff, as you can see here. A lot of it's the typical stuff you would expect an academic person to do, or someone that works in public health. But my big passion project is all things related to peers. So I've been, spending the last, however many years, I don't even know at this point, probably about 4 years, really kind of, breaking into that world and becoming a known trainer in the state for people in recovery that are looking to work on their own professional development along this career path. And so I've kind of made that a staple, in my business model. So basically for the trainings I'm currently offering for the state of Maryland with regards to peers, it's a 5-course series that are, some of the courses that were already mentioned even, on the ROPTA menu. But I, connected with the Maryland Addiction and Behavioral Health Professional Certification Board, which is, the entity that approves peer certifications, and, got authorization, for these courses to qualify for CEUs. And so now I am offering this series roughly about 4 to 5 times per year under the sponsorship of various programs. All of the courses come with approved CEUs from our authorized CEU provider, AHEC West. So AHEC in Allegheny County has absolutely been instrumental to my success in every way. We work very tightly together, we support each other, and we just find ways to take the different pieces of what we're doing and to, create a cohesive whole kind of picture. And so with that being said, another supporter who sponsors my peer trainings is the University of Maryland School of Medicine Training Center. And under this initiative, I'm doing multiple trainings per year. They cover my time. They cover any materials for the peers themselves. They handle registration. And of course, AHEC West is part of this collaboration as well by, being the CEU provider. So in addition to all the peer stuff, I got the honor of being selected by Archway Station, which is a collaborator in Allegheny County that I work with a lot, to help them conduct an evaluation of youth programs and services in the county. And it was a bit of a wild ride, but we had a really good time doing this. And I think we all learned a tremendous amount, and we were able to give a lot of recommendations to the county with regards to, gaps or deficits in programming. you know, a lot of it really centered mostly around gaps in making this programming known to citizens, right? There just wasn't a way for people to connect with this information. Interestingly enough, though, it did spark some attention, and it really provided a platform to launch from when it came to sort of sealing the deal on some other community projects, because one of the focuses here was to figure out how to better address ACEs and issues surrounding equitable access. So one of the projects that I was able to use this evaluation, you know, to sort of support is the skate park project in Cumberland. This is something that people have talked about off and on since the 90s. It always took a nosedive, you know, just because there wasn't the right folks sort of in place to lead and advocate for it. So right after completing the youth evaluation, I was then invited to join the skate park committee and sort of found myself in the co-chair role. And a lot of people were saying to me, why, you know, you're a mental health person. Why does skateboarding, what's this matter to you, you know? And well, there's lots of reasons why. And the first one is, see me right there? That's me. That's a nice sweaty me at the end of a roller derby practice. And this right here, that's my daughter at the end of roller derby practice. This right here, Frostburg State University professor, Tiana Bogart. Right here, Christy Snipes Richmond, who is a licensed behavioral health therapist in the state of West Virginia. You know, I could go on. So there's lots of behavioral health people, there's educators on this team, musicians. It's just an amazing, amazing time. And so we know that there's a strong skate culture in the region. We know that there is, you know, a multi-generational component to it, which really speaks to adverse childhood experiences, right? We get these folks that have a passion out there at the skate park. We let them work with the kids just organically, you know, and everybody wins. We just need to create these spaces. And all of this is happening in perfect timing with some research that was conducted by Tony Hawk's Skate Park Project and the University of Southern California, that all really sort of, you know, showed that people really did believe that skateboarding and skating in general, or anything with wheels, right, and these social spaces really serves to help, you know, overall mental well-being, as well as promoting physical health and you know, social cohesion. So, you know, in the end, the funny part is it was just announced we're finally getting a skate park. Woo! It's happening this fiscal year after years and years and years of, you know, just fighting for this thing. It's happening. So the work that we all do, people, this stuff works. It really does. We just, you know, have to take that data that we work so hard to collect, and it gets grueling, right? We all roll our eyes, more data, you know, but we take those things and we take them to our local leaders, you know, and really hit it where it matters, and great things can happen. This is going to be an all wheels park, which means it is going to be handicap accessible and very welcoming to all sorts of wheels, not just skateboards. So we're really, really excited. One of my big plans is going to be to rally around community-based organizations to consider writing grants and developing programming that includes use of the skate park. That way we can show our city officials that this was a wise investment. One of my other projects is working with the folks in Garrett County who make up the board of directors and overall work group for the Reflection House. So I was originally contracted by the health department to assist any of the good citizens of Garrett County who were actively working to get something like this off the ground. And one particular group rose to the surface, led by former attorney Tom Dabney. He's retired. And, you know, I tell you what a dedicated bunch of folks. You know, Garrett County doesn't get enough credit. I think sometimes, you know, it's easy to dismiss and say, oh, it's so rural, it's so conservative, you know, and all those things. And while that may be true, there's truly some dedicated folks up there that I've been working with for the last year and a half. And we're going to make this thing happen one way or another. So, you know, at this point with Reflection House, I managed to secure them a $200,000 grant from the Rural Maryland Council. And I helped the work group and board pitch to the Garrett County Commissioners to secure $120,000 in support from them to serve towards our grant match. And our awesome board members and community volunteers raised $80,000 in local private donations. which is just mind blowing in a place with a population, like Garrett County. I mean, that's really amazing. And of course, the organization's partnered with Appalachian Recovery Concepts and UMD Caesar regarding workforce trainings, because we're going to be using a social enterprise model that, in addition to the treatment and support piece for recovery, is also going to have a really heavy focus on workforce readiness and supports to get folks back out there and feeling independent. So the Mountain Maryland Forward Project is a project of the University of Maryland Center for Substance Use, Addiction, and Health Research, known as CSER. And this is a project that I sort of dreamt up, got with the ladies at CSER and said, let's do this thing, right? So we wrote, I don't know, like, I think maybe 3 grant submissions altogether before we actually landed one that stuck. But now here we are. We have a 3-year grant from the U.S. Department of Labor's Workforce Opportunity for Rural Communities Initiative in partnership with the Appalachian Regional Commission. And the Deputy Director, Aaron Artigiani, is the principal investigator for this. And I'm serving as the co-investigator with Barbara Kerr, helping us with the digital media piece, which is kind of her forte. Our overall objectives are going to be providing education to employers with the goal of creating a trauma supportive work environment for people in recovery to thrive and grow. And then, of course, build self-efficacy and job readiness through our various connections with the Western Maryland Consortium, Horizon Goodwill, and other entities. And we're working to support the recovery ecosystem and improve the utilization of existing services by trying to create career paths and direct linkages to these various sort of job placement services. And we are offering paid internships. We're trying to place at least 10 people in Allegheny or Garrett in paid internships per year, where we have the funds to cover 50% of that person's wages for about the first 90 days. This is to encourage second chance employment from local private employers. So this is what my partners look like on that particular grant. And I'm sure many are on this call right now. We work with a lot of great folks up here in Mountain Maryland. That's how it's got to be. There's no other way. We're under-resourced, so we have to rely on each other to connect and leverage the resources we do have. So the final big project I have happening right now relates to the state of North Carolina, and oddly enough, through a sort of accidental experience where Andrew Bell, who is still with JBS International at the time, many of you on the call may be familiar with Andrew. He was managing, some ARCOR grant recipients and invited me to help with a workshop. I go down to North Carolina with him to help with this workshop. Next thing you know, the CEO of Integrated Care of Greater Hickory said, hey, I want to do some stuff with you. Let's write some grants. So we've been writing grants, but in that process, he asked me to basically design a whole new 50-hour curriculum for his treatment center to get approved by the state of North Carolina to train peer support specialists. So I am about 85% complete on this job right now. It has been grueling, but I'm super stoked because the end result is going to be, not only is ICGH going to have a curriculum that they can utilize throughout the entire state, but I also have the ability now to replicate and adapt that curriculum throughout other states. And in North Carolina, they do things a bit differently. They have the University of North Carolina at Chapel Hill doing a rigorous academic review of these curriculums. So it's kind of exciting. It's going to be, pretty intense, but I think I'm going to have a good product when it's done. But I put this picture here in this little bit of bio about ICGH as one of my concluding slides, mainly because I wanted to highlight my excitement around working with this particular treatment center stems on the fact that Dr. Corey Richardson not only, does all these awesome things, he's doing these things that I have been wanting to do up here in our parts for years, when it comes to integration. He's also in recovery, 25 years in recovery. And he shared some stories with me, some more stories, and I could not be more impressed with how far this man's come and how he has really put his recovery into action through helping others. And I'm just so excited to be able to be part of his journey with regards to that. And we're currently in the talks for opening an integrated care of Western Maryland. So more to come on that piece. But that's it for me. But I will say that coming down the pipeline, one of my longtime partners, Rob Zellner, who is also a person with lived experience, he and I have formed a nonprofit called the Underdog Foundation. And we've got a lot of stuff in the works for that. So, be on the lookout. You'll see stuff flying across social media soon, I hope, alerting everybody of what's going on with that project.
Thank you so much, Stephanie. I think you had some great information to share there, and comments in the chat box too from people singing your praises. I think a lot of us wish that we could be you in some way because you do so much interesting work. And wow, that skate park, that's like such a great example of applying all of the, the research and the ACEs into something super practical that people are going to get use out of. Like, wow. So yeah, thanks for sharing that.
Thank you.
Great. Well, for our next partner spotlight, we are going to pass the torch to Kate Fahrenholt, who is the Executive Director of NAMI Maryland. And we thought that it'd be great to highlight NAMI, particularly because a lot of the work that people in this call are doing is educational and also advocacy related. And so I thought that NAMI would be a great partner to highlight, in especially as it relates to their advocacy work that they do for all of us on mental health issues across the state. So I'll pass it over to Kate.
Well, I thank you. And I apologize ahead of time because my computer has been doing some weird things, so I may go off camera periodically. Anyway, those of you who don't know, and I just wanted to say I do recognize several of you, but just a shout out to Jeff Schultz, who is involved with us in Queen Anne's County. Without further ado, I'll just quickly explain what NAMI does, and bear with me, I'm looking at my my notes. The mission of NAMI Maryland is to improve the quality of life of individuals with mental health conditions and their families. And that means that a large proportion of our entire population is part of that. And they often have, of course, co-occurring issues. We're dedicated to providing free education support and advocacy for persons living with these conditions, their families, and perhaps not always as free, resources for the wider community, most of it free. NAMI Maryland is a NAMI state organization in Maryland. There's a national federation or alliance. We provide public education workshops, teleconferences on specific issues. We carry out an ongoing campaign and public policy agenda to improve behavioral health services throughout the state. And I apologize, I really dislike that term, behavioral health, but it's the attempt to combine substance use and mental health issues. And to reduce stigma and to support effective treatment and recovery programs. We have a very small budget. We have 9 staff who do their best to support and coordinate literally thousands of volunteers across the state. We provide the free trainings that allow local NAMI volunteers to offer free evidence-based peer support, education, and outreach programs. We are also now providing our free courses virtually for families and those for adults with mental illness in non-metro areas. We've done a big expansion of that. We tested it when COVID started, and we have been overrun, quite frankly. And so we're going to continue that. We After a major reset brought on by the pandemic, we're working with that small budget and staff to expand and support and even restart, in many cases, the amazing work of our volunteers in non-metro areas in Maryland. We have a strong statewide network of more than 58,000 families, individuals, community-based organizations, and service providers. And just note, I'll just say to Stephanie, I love your peer support specialist. I was involved in the development of the certification program process in Maryland, and there's room for improvement. But I will say that I did not do this, but many of our programs count toward the Maryland peer support specialist certification, including our NAMI peer-to-peer relapse prevention and recovery course. It's our core principle that lived experience gives people expertise if people are empowered. And so it's also a critical, empowering people, family members and individuals is critical in recovery. And it's also a very potent force in providing community education and also advocacy. So real quickly, I'm sorry to, but I'll run through a policy overview. This may sound, I may be repeating a lot, so apologies if you already know all this, but last session, over 2,000 bills were introduced in the 90-day legislative session. There were over 50 new members and a brand new, of course, gubernatorial administration. That provided a lot of opportunities, but also a lot of roadblocks, temporary roadblocks. Many legislators, including legislators in leadership positions now, highlighted the importance of bolstering Maryland's public behavioral health system. So that's huge. The governor and the secretary of Maryland Department of Health, Laura Herrera Scott, have made improving the public behavioral health system a top priority. And as a matter of fact, well, I'll talk about that in a couple minutes. Some of the major issues that policymakers are looking at are ensuring that there are an adequate number of behavioral health providers in Maryland, of the range of providers, which includes peer support specialists, all the way through to other professionals. Ensuring that there is adequate access to insurance, including Medicare and Medicaid coverage for those who need services. We've got a long way to go, especially on private insurance, but also, and ensuring that a service is provided may be adequately reimbursed for the maximum population that will qualify. Some of the outcomes that we had, we have FAQs on all of this, so if you want any of that, I'll be glad to share. But 988 funding, which I want to note, everyone secured an additional $7 million in funding for the 988 Trust Fund for the 2025 fiscal year for a total of $12 million. What we want to know is, the funds may be used, are allowed to be used for crisis call centers, mobile crisis team services, crisis stabilization centers, preferably evidence-based centers, and other acute behavioral health care services. The bill is being sent to the governor for his signature still, but it is one of all of our advocacy roles to make sure that those funds are focused on not just the phone, but all of those other services, and not only that, but direct connection to ongoing services and follow-up with people. Also, there was the Behavioral Health Treatment and Access Model bill that passed, and it established a new commission. Maryland's very good at this, but we're excited. A commission on behavioral health care treatment and access to make, it's a four-year or five-year commission to make recommendations to provide adequate, appropriate, accessible, and comprehensive behavioral health services in the state, and provides, it establishes a new healthcare coordination value-based purchasing pilot program, which is supposed to reward quality of service over quantity. And it also extends the coverage of audio-only telephone coverage in the definition of telehealth. Youth wraparound services, quickly. It requires the Maryland Department of Health to expand access to and provide reimbursement services for certain wraparound, intensive in-home and case management services. It also requires that beginning in fiscal year 2024, the Behavioral Health Administration will fund 100 slots in the mental health case management program for children and youth at risk of out-of-home placement who are not already eligible. The Senate's behavioral health package, which included a number of those bills, they created a package as a priority to make mental and behavioral health priority this past year, and created this package of 7 bills. And it included the items that I just mentioned, plus codifying the collaborative care pilot program as a permanent program, if anyone knows about that. Certified community behavioral health clinics, requiring the state of Maryland to actually apply for federal funds related to funding such clinics. And I guess I mentioned the other things. Sorry, I'm going so fast. One of the things I wanted to mention is that there is something, in addition to this new commission, which will stand for 4 or 5 years, there is something called the Maryland Behavioral Health Advisory Council. And I do think that there is potential for a number of you to at least weigh in or access some of that. The BHAC, is a statutory council required by law to review the work of the Maryland Department of Health and the Behavioral Health Administration. I am currently the co-chair, and Katie, there are 2 Kates, Kate Farrenholt and Katie Dilley, some of you may know from Midshore Behavioral Health and MABA. We are working to make it an effective advocacy arm that can advise the governor, which is in its statute, but we want to make it more effective. We review the state's behavioral health state plan. We review applications for federal block grants. We have multiple committees, and many of them could benefit from Maryland ROPTA participation, including a prevention committee, Children, Youth, and Families Committee, Recovery Services and Support Committee, Criminal Justice and Forensics, etc. We are also going to be working with Maryland Department of Health and Behavioral Health Administration on the implementation of this new commission. And as a matter of fact, Katie and Kate will be meeting with the Secretary of Health about that specifically next week, I believe. Here, let me see, how fast am I going? Okay. So how NAMI discusses rural health and prevention. And I wanted to, in terms of an advocacy role, et cetera, you all know that mental health, illness, and substance use often occur in individuals at the same time. Sometimes they are officially co-occurring in the sense that they are equally there. Other times, someone with a substance use issue or an addiction will develop mental health issues as a result of their living conditions or their actions, etc. Or vice versa. Many times someone with a mental illness will self-treat and develop a substance use or a gambling or other addiction issue. So there are all these different overlaps, and we are very, very well aware of that. Also, rural Americans, as you know, I'm sure, experience higher rates of substance use, higher rates of mental health issues, and higher rates of suicide than people who live in urban areas. But they are much less likely to to try to or be able to access behavioral health care services for a lot of reasons. Suicide rates among people living in rural areas are between 18 and 20 per 100,000 residents compared to 10 in urban areas, which is always surprising, but to me, as an urban resident. I'll just real quickly, we have all these fact sheets, and I have a couple of things. In rural areas, non-metropolitan, we say, access to treatment is severely limited. Just talking about mental illness, 48% in 2020, 48% of people with a mental illness receive treatment. Okay, that sounds pretty good, actually. It shouldn't be, but it's better than some. 62% with a serious mental illness received any care. Okay. Compared to suburban and urban residents, rural Americans have to travel 2 times, as much as 2 times as far to their nearest hospital. You know all this. And internet is, I know Maryland's been doing a lot and you all are working on it, but internet is still something of an issue. Also, of course, 25 plus million rural residents live in what we call mental health professional shortage areas. Maryland has terrible shortages all across the state, but rural areas are especially affected. So of course that affects access issues. COVID affected a much higher, or at least self-reported, affected a much higher number of rural residents in terms of saying that they had mental health issues relating to COVID. And that was 71% of younger adults ages 18 to 34. And I could go on and on and on. Postpartum depression, there's all sorts of statistics. But the question of access is a huge thing. Let me see if I can, yeah, my computer is sort of messy here. So again, comorbidities can also exacerbate an existing substance use issue and or a mental illness issue. So our population, people with mental illness, will die 10 to 15 years before the average American, not from their mental health condition, but from high blood pressure, diabetes, and cancer. Okay, so there's also a problem, and I'm sure you see this in the substance use field, that quite often the physical issues are not addressed because the focus is on the substance use or the mental illness. Beyond the lack of behavioral health resources, we all know that there are some unique challenges, barriers that play a role in determining whether rural residents get the mental health care, and I'm assuming substance use care, they need. They often fear negative judgment from family, friends, and members of their community, concerns about being perceived as weak or incompetent if they admit to having a mental health or substance use condition. And of course, even more, as members of small, close-knit communities, many rural residents also worry about being able to maintain confidentiality concerning such matters, which has led to the oversubscription, quite frankly, we're very excited, of our statewide virtual education courses, because people say, I don't want other people from my community to know I'm getting support. Obviously, there are problems with access, but also the stigma is a major barrier. And I won't go, I know I have limited time, so I won't go in further. What I'll say is that we have core priorities and advocacy priorities, and I'll just, and we can go at any time you want to, I can give you more information, but our core priorities, policy priorities, are early intervention, and that means early detection and early intervention. And so I know I can give you all the statistics, but I believe it, for people who have the first signs of schizophrenia, it can take more than 10 years for them to get the actual diagnosis and the treatment, which means that they've had 10 years of severe, continuing expanding issues. My sister has schizophrenia. Access to treatment and services, huge issue. And that covers everything from health coverage, expanding the peer workforce, having public health, having a less fragmented behavioral health system. If we, I can say this as an advocate, it's not, in my view, a system. Okay, we need to build a full system that reaches everyone equally, no matter where they are in the state. We also, third priority is to reduce racial health disparities. And the last priority, not last, but the highest priority is to strengthen Maryland's mental health crisis response. And that means also to reduce criminal justice involvement. I can talk a lot more about that, but I'm looking at my time and I just want to end with a couple of additional things. So let me give you, overcoming stigma is really huge. And that's not a policy priority, that's a priority. Increasing awareness is a that these things are health conditions like cancer, heart disease, or diabetes is one way to help overcome stigma in rural communities. In addition, as people have mentioned, lived experience, talking openly with others about lived experiences with behavioral health challenges helps to normalize the conversation and diffuse the stigma surrounding these issues. We started the NAMI Walk. We now have 500 across the state, but across the United States. We started it in Maryland, and that was 20 years ago in order to, quote, start the conversation. And that's the last thing I will say is we are really trying hard to reestablish and expand and NAMI's presence in non-metropolitan areas. We're doing the statewide classes, but all, I will say NAMI Kent and Queen Anne's County, which is a program of NAMI Maryland, their volunteers are doing amazing work. We need to help them do more, but many other of the rural areas, we are restarting NAMI presence after the COVID hit. So love to talk to you, and I'm sorry I went on so long.
Thanks for sharing, Kate. So hopefully what we all take away is that, NAMI can be an amazing resource, not just for the support that it directly provides to people living with mental illness and their families, but also in getting you plugged into the advocacy. And it does start at the community level, meaning if you're interested in learning more. Kate, did you say you had fact sheets about the legislative priorities or anything in that realm?
Oh yeah, we have our public policy priorities, we have our legislative priorities, but our legislative priorities for next year, our coming year, will not be official until December.
Okay.
Right. We also, I just wanted to mention, our Smarts for Advocacy training is for people with lived experience, but it can include other people and how to use your own lived experience to advocate. We can consider, and we have allowed people who are providers, but also people who are not people with mental illness into that program. I can't guarantee that, but yes, we have lots of fact sheets.
Yeah, thank you. Yeah, so I really encourage everyone to check out the NAMI webpage and to get in touch with them about some of the efforts that you could be a part of in your community, and think about if NAMI isn't necessarily strongly present in your community at this point. I'm sure Kate would love to work with you on getting something going in your community, whether that's support related or advocacy related. They've got the tools. So I'd really like to thank everyone for participating today. Thanks to Kate and Stephanie for sharing about the works that they're doing in support of mental health and substance use in Maryland. And we're really looking forward, from the Maryland ROPTA team, we're really looking forward to continuing to work with you all and provide programs. Julie did just share a link in the chat so that you can make sure you're on our monthly newsletter, as well as some of our September Recovery Month events that are happening.